It's a new year, and it's time to get those yearly checks on the calendar.
You know, you start the year and go, okay, I got to do this, eye doctor, I got a dentist, It's important not to skip those doctors because it all works together. Joining us now is our 9 News medical expert, Dr. Pyle Coley. And the annual exam, that's one of the things that you're like, why do I need to do this? But you think that there's so many things we should be discussing. We should be taking total advantage of this opportunity.
Very much so. In fact, there's data that people who go for an annual physical actually live longer. So it's been associated with a higher life expectancy because you're getting ahead of the problems. Mm-hmm. You're not waiting for them to declare themselves. You're being proactive, not reactive. So I can't emphasize this enough. And it's also a really great opportunity to have a connection with your doctor so that if you ever do need them, when you're not feeling well or what have you, they're sort of up to speed on what's going on with you. Because if you only go see them once every 10 years when something horrible happens, they're behind.
Yeah.
Mm-hmm.
Yeah.
And I mean, you mean comprehensively go everyone, the eye doctor, the dentist, because they can even maybe pick up other things?
Yeah, so it's really very cool. I like to say that the eye doctor is really my eyes, no pun intended, because they show me stuff about the heart that I don't even know. So I have patients that come to me from the eye doctor because when you get your eyes checked, it's not just the vision that you're checking, which of course is important for our day-to-day life, but they actually look at the blood vessels in the back of the eye. And these are teeny tiny blood vessels called the microvasculature. And if there is a nick in a blood vessel, a little cholesterol plaque in a blood vessel, these are all signs of heart disease that the eye doctor will see long before I see a heart attack or a stroke happening. So sometimes I'll get patients from the eye doctor because they're literally looking into their blood vessels and telling me what might be wrong. Similarly with the dentist, we know that people that don't get regular dental cleanings, have periodontal disease, have a higher risk of heart disease because all that gum inflammation, the gums are sort of a direct line to our bloodstream. They create inflammation in the bloodstream that then causes those blood vessels to get heart attacks and strokes because they get sticky. So it's really important to go see those types of doctors. But of course, your regular medical doctor, and I usually have like a top 3 list that I tell my patients.
Well, it's funny. First of all, I went to the eye doctor yesterday, and that's what he told me.
Good for you.
He said, it looks so good. I don't see any things that would lead to blood pressure or heart. And I'm like,
wonderful.
What in the heck does that have to do with? And that's kind of what prompted me to talk to you about this.
Yeah.
Also, when we do that annual exam, I kind of sometimes just schedule it. And then when they remind me a couple days before, I'm like, oh, yeah, I got to go. I should come in prepared with some questions and ideas.
You have a list, Kim and Alex. You have a checklist and you're going to go down it. So we're going to go most common first, heart disease, right? So you want to get all your heart disease screening, your blood tests, your urine tests, an EKG, which is an electrical map of your heart, as well as something called a calcium score if you're over the age of 40, which already does an x-ray of the heart to tell you if you already have plaque. All of this will predict the future and tell us how to avoid dementia, heart attacks, and strokes when you're older. Second common thing, cancer. So for men, we want to talk about prostate cancer. For women, it's cervical cancer, breast cancer, and for all of us, we want to talk about our annual colonoscopies. And then the third, which we don't discuss enough, is our hormones. And we have, as women go through menopause, perimenopause, and as men, we go through something called menopause. And so talking about our thyroid levels, talking about our estrogen, talking about our testosterone, seeing if it's something that we need to discuss or replace, that's really important. And then fourth, I usually say is weight management and nutritional supplements. We all take all these vitamins. I have patients coming into the office with a long list of vitamins. And they don't even tell me when I'm asking them what medicines they're taking. Ask your doctor, do I need a multi? Do I need an omega-3? Which vitamin test should I get checked? I usually check vitamin D in my patients because that's an important one that most of us are low in.
But not everybody just needs a multi. I thought that was just like
No,
a little
in fact,
Flintstone.
most people don't need a multi according to the preventive guidelines now. So if you're taking a multi, you probably can get rid of it and save that money. Only certain people that are at risk for nutritional deficiencies with gastrointestinal disease, Crohn's disease and such, they might need a multivitamin. But for most of us, we can get rid of it. I also want to emphasize now that there's a new definition of obesity. So we're moving away from using BMI, body mass index. We're now actually using what's called a clinical definition of obesity. So we're trying to identify people that don't just maybe have extra weight, but have extra weight that's causing problems. This is a more comprehensive way to think about obesity. And one other thing we don't often do, everyone should grab a measuring tape and measure their waist circumference, because how wide your waist is around that actually predicts your risk of heart disease better. So these are all things at your annual physical that you can really sort of do. I don't think about my ears often, but everybody over the age of 50 should have a hearing test every 3 years in order to make sure they don't.
That.
And then sleep. sleep test and make sure we don't have sleep apnea. So many things to think about, but having a checklist and being prepared is really the best way to go into that visit.
I got my physical. I didn't do a fraction of what you just said. So now I feel like might need to go back. All right.
But next
Okay.
year you will.
We're getting our
I will.
money's worth by doing that too.
That's
Thank you,
right.
Dr. Coley. You can find more from Dr. Coley, all of her advice on 9news.com/Dr. Coley.